Hello there, it's Dr. John and Dr. Chelsea with me today.
Hello.
And we want to talk about hip and knee replacements. So, pretty common thing. So, what are the sort of reasons that people come for or get told that they need a hip or a knee replacement?
Absolutely. So a lot of times people will come in and sometimes their first protocol will be to a surgeon. So the best things that a surgeon's going to offer is going to be a hip or knee replacement. They might be going there because they've got a lot of pain, they've got a lot of degeneration that comes up on x-ray, so that it looks like that there's not a lot of room to move.
I understand, yeah. And when people get these, what are the results like when they get these replacements?
Hip replacements have been shown to have a really, really high efficacy, which means that they've just been really successful for that person, which is really good. Knee replacements are a little bit shakier. They tend to just have a little bit more recovery time required to get through them, often because that knee joint's in the middle. It's a bit of a hinge, and so sometimes the problem can be coming from the hip or the ankle. So it's just a little bit more complicated when they're on there.
Yeah. I know to say I have the same sort of experience. People with hips, they can be a fantastic result. Knees, they tend to be sometimes good. They take a long time to recover from them. So if people were looking for an alternative, what sort of expectations could they have if they came to a chiropractor such as yourself?
So if they came to us here at Canberra Spine Centre, then something that I'd be looking at is their ankle mobility, their knee and their hip, because it's all a part of a single chain. So if you're having an issue in one, it can definitely affect things higher up or lower down, of course. What we would look at doing is some strengthening, but also making sure that we've got good mobility in all of those areas. From there, what we would also add to them is some rehab exercises. There's a lot of research that's going into going away from some more of those surgical options and looking at the rehab instead. What's a really positive thing about it is that pre-surgery, it's always recommended to be doing some rehab to make sure we've got mobility and we've got strength in that area to start with. So going through that process, we'll probably have one of three outcomes. One, that they still might need the surgery, but what's great is they've got that strength, mobility and support going into it. Number two, we might be able to delay that for even longer, which is great because, as we know, replacements have a lifetime. And then the third is that they actually might not need that surgery at all. So really good to kind of check down that conservative route first to maybe avoid something that they
Absolutely. I'll have to wholeheartedly agree with that. Just something conservative first before you go under the knife. And there's a good chance that you either won't need it, or if you still need it, it's going to be a better outcome. All right, so hopefully you've learned something from that, and thanks very much, Dr. Chelsea. And if you've got any queries, please get in touch with us, either via email or phone, and check out our other Facebook articles this month too. Bye-bye.